Good day everyone, I am Cecil May Calaksan. For today, I will be performing a return demonstration on the assessment of eyes, ears, nose, and mouth. So prior to performing each procedure, you need to perform proper hand hygiene and use clean gloves if necessary. Provide privacy. After this, you can now proceed with the assessment. Hello sir, I am Cecil May Calaksan. I will be your student nurse for today. May I ask what is your name, sir?
Dominador S. Baliwag Jr. po.
When is your birthday, sir?
October 26, 2007 po.
Okay, sir. So that is the first thing that we need to do. We have to identify our patient in order to ensure that we have the correct patient in front of us. And then we can now proceed to explaining the purpose of the assessment to the patient. So, how do you want me to call you, sir?
J na lang po.
Okay, Sir J. So today, I am here to perform an assessment on your eyes, ears, nose, and mouth in order to ensure that everything is normal. If there are any abnormalities, we are going to take note of that. So anyway, how do you feel today, sir?
Okay lang naman po.
Okay, sir. Have you noticed any noticeable changes on your facial features?
Wala po.
Okay, sir. Any pain or discomfort?
None po.
Okay. Do you have any question for me before we begin?
Wala po.
So now let us proceed to the inspection of the eyes. I will be using some special instrument to do so, and I will be also be touching some part of your body as well, specifically your eyes and face. Is it okay, sir?
Yes po.
Okay, sir. I will now proceed with the assessment po. So, sir, I'm gonna proceed to inspecting your eyebrows. It seems to be symmetrical on the left and the right side. So, can I touch it?
Yes po.
Okay, sir. So, the distribution of the hair seems to be even and normal on the left and the right side. So, the patient eyelashes are evenly distributed. Sir, can I touch your face again?
Yes po.
Okay. Okay. So, the patient eyelid seems to be symmetrical, also both on the left and the right side. So, sir, could you please close your eyes tightly and open them for me? Okay. So, the patient has no trouble opening and closing the eye. The eyelids are covering the part of the sclera, which is normal. Now, we're going to continue to assess the patient's palpebral conjunctivae. So, sir, could you look down for me? Okay, so I'm gonna pull on your lashes a bit, okay? Okay, could you blink for me, sir? Okay, and the other side? Do you feel anything, sir?
Nothing po.
Okay. So there's no swelling, no presence of foreign objects, or any pain felt by the patient as I did check the palpebral conjunctivae. So now, sir, I'm going to proceed to palpating the lacrimal glands. Sir, is it okay if I touch your face?
Yes po.
Okay. So there seems to be no swelling and everything is normal with the lacrimal gland. So, sir, I'm going to proceed touching your nasolacrimal gland. Can I touch your face again, sir?
Yes po.
Okay. Do you feel any pain as I touch it?
Nothing po.
Okay, so patient feel no pain and there is no present of swelling. So now, sir, I'm going to proceed to assessing your conjunctivae. So, sir, is it okay if I touch your face again?
Yes po.
Okay, sir. So, sir, could you please look up? Okay. Okay. patient conjunctivae is pinkish in color. There seems to be no foreign bodies or any types of swelling or infection. So patient conjunctivae is normal. So now we can now proceed to inspecting the conjunctivae, the sclera, and also the cornea of our patient. So inspecting the cornea of our client, we want to have the test for corneal flex, and in order to do that, we need to grab our pen light and shine the light just in the middle of the nostalgia. So what you're trying to look for here is the spot where the light is being reflected. If the light is reflected at the same spot, that means it is normal. But if the light is reflected not at the same spot, that would be abnormal. Sir, can you please stand? So what I'm going to do is to show fingers on the side while one side your eye is covered. You're just going to tell me how many you see, okay?
Yes po.
So let's start. How many fingers did you see?
2 po.
Okay. What about this?
1 po.
Okay. Could you blink for me? Okay, let's do the other side. How many fingers are there?
3 po.
Okay. How about this?
2 po.
Okay. So the patient can identify how many fingers are there. So now I'm going to assessing the patient's ears. So I'm going to see if your ears is level to the side of your eyes. So the patient's pin of the ears is almost at level of the patient eye. So now we're going to palpate the cartilage and the mastoid process of the patient. So sir, I'm going to touch your face again. Is it okay?
Okay po.
Okay. So do you feel any pain as I touch?
Nothing po.
Okay, there's seem to be no swelling, the cartilage. Okay, now to the mastoid process. So can I touch again your face, sir?
Okay po.
Okay. Do you feel any pain, any tenderness?
Nothing po.
Okay, there's no swelling and no masses, so cartilage and mastoid process is normal. So now we're going to assess the patient's ear canals and tympanic membrane. So I'm going to touch your ear, okay?
Okay po.
Okay. Do you feel any pain as I'm pulling your ear?
Nothing po.
Okay. Another one. Do you feel anything?
Nothing po.
Okay. So patient's ear canal is same with the color of the ear, and there's no present of foreign bodies. There is cerumen or wax, which is totally normal for the patient. So now we're going to assessing the patient nose. So patient nose is in the middle of the face or midline. There seems to be no deviation to the left or the right septum is normal. Both nostrils are normal. So sir, we're going to occlude one side of your nostril. So could you occlude it for me like this? Okay. Inhale. Exhale. Did you have a hard time breathing?
No po.
Okay, good. Now the other side. Inhale. Exhale. Did you have a hard time breathing?
No po.
Okay. So patient can breathe normal even one side is occluded. So there is no obstruction in the nose. Okay. So now we're going to palpate the patient external nostril or the nares. Do you feel any pain as I touch it?
No po.
Okay. Now we're going to proceed to checking the patient's internal nerves. So sir, I'm just gonna place my hand on your forehead until it backbeat, okay?
Okay po.
Okay. Okay. So, patient's nasal mucosa is pinkish in color. There are no swelling, no foreign bodies. There are no present of exudates. There is also no septum perforation. So now we're gonna proceed to checking the patient's sinuses, the maxillary, and the frontal. So, sir, I'm gonna touch your face again. Is it okay?
Yes po.
Okay. Make sure you disinfect your hand before touching the patient. So, there seems to be no swelling. Was there anything pain, sir?
Nothing po.
Okay. So, now we're gonna proceed to inspecting the patient frontal sinuses. So, do you feel any pain, sir?
Nothing po.
Okay. So, there are no swelling. There are no pain as the patient told. So, now we're going to proceed to check the patient's mouth and lips. So, let's start. Okay. So, patient's lips are symmetrically both the left and the right, and there is no lesion, no bleeding, no edema, or any problem with the lips. So, can I touch your lips, sir?
Yes po.
Okay. Wear gloves as you do this, so patient's lips are soft and smooth. So, now we're going to proceed checking the patient's teeth. So, sir, could you smile for me? Okay. Could you open your mouth, please? Okay. So, there are 28 teeth, which is normal for a 14 years old boy like him. The dominant color of the teeth is white and there is no malocclusion. Sir, could you please stick out your tongue? Okay. So, I'm gonna touch your tongue, sir. Do you feel anything? Okay. There seems to be no swelling, no pain, no presence of exudate, and the tongue is in the midline. It is not debating to the left or the right side. Sir, could you please say for me? I want you to say like really long. Okay, sir. So, patient's uvula is vibrating or moving as he say which is totally normal, and it is pinkish in color. The tonsils are perfectly normal. It is around 2.5 centimeters. There is no swelling also on the uvula or the tonsils.